Welcome to the Real Life Podcasts with your hosts, leadership and personal growth author and speaker John C. Donahue and licensed psychotherapist Lou Carfisi. The Real Life Podcast is your weekly dose of motivation, encouragement, and direction to help you live your life at the highest level.
So hello everybody, and welcome to our Real Life Podcast. If you're listening to a recording or watching an old recording, thanks for watching. We are so glad that you're here. My name is John. I come to you from johncdonahue.com. Joining me, as always, is my partner, my co-host, my very best friend, Lou Carfisi. How you doing today, pal?
I'm doing really well, my friend. You can come see me at lifecarecounseling.net.
Absolutely. And Lou is a licensed psychotherapist. We're going to really dig into that a little bit more in just a few moments when we really dig into the show. But we are the Real Life Podcast. We do a weekly podcast. It comes out every Wednesday. You can find that over at reallifepodcast.com. You can talk to us through questions at reallifepodcast.com, which is our email address. You can also find us on Facebook at reallifepodcast.com and Twitter at reallifecast. We just wanted to change it up and make it a little bit different. So that's where you can find us online. And we always do, we try to do a Monday blab every week at 3 o'clock Eastern time. So we can do a 20 or 30 minute little chat, and then we open it up for questions, and it becomes a very interactive opportunity for you to talk to us and get some advice or throw us some suggestions or some ideas. And it's a great way for us to talk to you guys. So that's something that we have committed to. And I think we've only missed one. We recorded a podcast during it. Yeah. So, we've done a pretty good track record for the last 2 months. So anyway, so that's who we are. That's how you find us. And today is going to be a fun day. We decided that we're going to pick apart a little bit about what we do separately. So Lou is the first one up, the guinea pig, so to speak. We're talking about therapy. What's it good for? So we can kind of dig into that a little bit. So let me ask the first question, my friend. If there's somebody out there who is maybe struggling with an issue or has been encouraged to talk to somebody, how can therapy help them?
Yeah, it can help in a lot of ways, John. People think that if you go to therapy, that others are going to think that you're crazy if they find out. You're going to think that you're crazy by going there. The reasons vary as to why people come in, but how it can help you is that it can help you look at yourself from another perspective, if necessary, change how you think, and therefore change how you behave, and do a lot of things and get a lot of tools like problem-solving skills, coping strategies for things like depression, anxiety, issues in your relationship, unresolved childhood issues, which if you bury them, they're going to come up and they're going to get you when you least expect it. There's therapy is great for those who need it or those who really want to try it, but there's also the issue of counseling. And I want to make a distinction here between counseling and psychotherapy. This is my own opinion. I'm sure people will agree or disagree. Either way, it's my opinion. Counseling is more along the lines of helping people in support role. What is it that you want to do, and how can I help you get there? And that's more of a counseling thing. Psychotherapy is when we've identified a problem using some instruments like we use the Young Early Maladaptive Schema instrument, which is just a test that you take. Doesn't go anywhere, but it helps us pinpoint the exact areas in somebody's mind or in their past that is causing them a lot of dysfunction currently. So those are the two distinguishing things. I'm having trouble talking over my lips today. Those two are the distinguishing things that I believe distinguish psychotherapy and counseling.
So get this, if I'm understanding it correctly, a counselor or doing just counseling is more just helping or assisting with an issue or maybe a perceived issue. And then if you discover in that process that something is really amiss or there's really a legitimate problem, that's when you might go down the road of something a little bit more serious, which is therapy.
Right. Well, someone may come in and say, I'm having trouble with my relationship. I say, okay, how are you having this trouble? What's happening? I'm trying to decide whether or not I should leave my husband or leave my wife. And that's okay. We can handle that from a counseling perspective. Well, tell me about the situation. How is it affecting your life? Has it been going on long? Did you know this about him or her when you first started? All those questions come up. That's an example of going to counseling. Going to psychotherapy means that you're depressed, means that you have a problem. Could be a personality problem. It could be an interpersonal relationship problem, trouble with your family in terms of how they're affecting your life in a negative way or affecting your marriage in a negative way, or how bad parenting has brought you to the point where you're getting panic attacks, your anxiety, you don't feel well about yourself, you have very low self-esteem. Those are some of the things that would come under that handle.
Right. And that's in no way an exhaustive list.
No, that's just the tip of the iceberg.
Okay. Well, what about the person who is saying to themselves, well, I hear what you're saying, but I can really handle my own problems. I don't need somebody. I can just go read a book, or I can just take a vacation, or I can read a blog article. Do they really need therapy? Is that something that they have to have?
Depends on the severity of what they're going through. If it's very severe, after you read your book and you go on vacation and you do whatever you're going to do, make an appointment, because it's really the answer. If you have something that is, we call them emotional problems, we call them psychological problems. It doesn't really matter what you call it. You don't feel good. You don't feel well at all. And you're having trouble in most areas of your life, or at least the area of life that is most affected by, Lord knows what. It could be bad parenting, as I said earlier, or it could be circumstances that happened, trauma that occurred when you were young. Those are the types of things.
Okay, so if somebody is thinking about this and knows that they can't handle it for themselves, how does somebody know that therapy is the right course of action?
Well, I think I laid that out earlier. There's many reasons for people to go to psychotherapy. Okay, it may be a major life transition. You may have lost a job. You may be in jeopardy of having a divorce, or you're stressed, and there's a lot of bad things happen to you. Some people need assistance in managing that low self-esteem, depression. Those are the things I mentioned earlier.
Right.
Even spiritual problems, because we all have conflicts, and we need to have some tools to help us get over them so we can live our life and have a decent quality of life,
right,
and then fix the problem.
Right. I'm a big fan of counseling or light therapy for couples. Even if there's not really a problem, if there's really a problem within the relationship, if I'm talking to people in what I do and I'm sensing that there's a real legitimate problem, I'll say, you definitely need to talk to somebody. If not a therapist, maybe a counselor or somebody who has that type of training. But I'm also a big fan of people who've been married for 10, 15, 20, 25 years to periodically do that preventative maintenance. And that could be helpful too.
Oh, absolutely. If everything's going well, I always believe if it ain't broke, don't fix it. But there's something that's going to be broken in a relationship. And if you dig into relationships, there's a reason for this. Because you have a husband here who is the product of generations of parenting, be it bad, good, or different. And you have a wife with similar circumstances, but from a different parenting point of view, usually. And each one of those parenting styles has created the dysfunction that you're feeling. Okay. if that's the case, if you feel dysfunction, you don't really know where it is, I'm not suggesting we go back and kick mom in the shins because she was a rotten mom. We don't do that. This isn't a ghost or witch hunt to try to go and blame somebody for all your problems. You are responsible for yourself, your actions, your behaviors, and the things that you say. But it's easier for you to understand if you understand what happened. You know, maybe one of your parents was suffering from a mental illness. Maybe they were seriously sick. Maybe one of them died. You know, maybe they never were taught how to take the time to go ahead and and parent properly, because they weren't parented properly. And when you have these two people with this kind of a history, chances are they're going to go like this. They're going to butt heads. It's always going to be a problem for them. Even if it's only a little problem, they can bloom into something that's really uncomfortable. We have to find ways of doing this. Work together, compromise, understand each other. And that's how that works.
Yeah, I think that we really started sort of unpacking that in one of our episodes of the Real Life Podcast that you can find over on reallifepodcast.com. We were talking about relationships. We were talking about the marriage relationship, and we started talking a lot about, how our parents can cause problems even unknowingly. But we did dig into that. And I think that would be a good listen for somebody who is, maybe on the fence about deciding whether or not to get into counseling or therapy. So I think that would be a good listen.
Yeah, I agree. That would be helpful.
So what is therapy like? I mean, we all have this vision of, I go into a dim office and I go lay down on a couch, and then you're going to get out your, yellow spiral bound notebook piece of paper, and you're going to put your pipe in and your tweed jacket, and you're going to sit and you're going to say, so how does that make you feel? I don't know that's stereotypical because it's what's on TV. What is therapy really, really like?
It's different for everybody. It's not the same for everyone. I do have a couch, but you have the option of laying down if you want to. But it's better to look at each other, face to face, and that's how I prefer it to be. In my environment, it's not that dark. It's kind of, but there's no like a 100-watt light bulb shining on the top of your head, and you feel like you're in the Inquisition. It's more of a more like a living room type of setting. It's all to make you feel comfortable in order for us to create a relationship. The therapeutic relationship is the answer to fixing problems. If you don't have a good relationship with your therapist, then you need to find one that you can have a good relationship with. Therapy is that's how that starts anyway. Good.
So how does it work? I mean, I come in your office, we sit down, and then, and I know it's everybody because you're working on different things, but it's basically you talk and I listen, or I talk and you listen. Is there a conversation? Physically, how does it actually happen? How does it work?
Well, I use questioning. I guess you could call it open-ended questions. Are you feeling good today? No. Well, that kind of cuts the conversation short, doesn't it? So tell me about how you're feeling today. This is an entree into the relationship. But once the relationship is established, so, how's it going with Kenny today? Is everything okay? What's been going on? It becomes more casual, but then I get more information. And the reason I need information is so I can help you. Therapy is back and forth. In most circumstances, it's almost like an attorney and a client, because we have to argue against the dysfunction, and we have to argue our case in order to make the patient realize that, hey, listen, it isn't all my fault necessarily. And believe me, if it is all your fault, I'll tell you. It'll be a short session. But mostly, people who come to you for help want help. I get the occasional teenager who's mandated that comes in and that doesn't usually work well for them because they're rude, they're disrespectful. That's not what you want to go in. You want to go into a relaxed atmosphere and understand why you do what you do. What are the things in the background? And I will tell you those things. Right. If you ask me a question, I will answer it. I may introduce some theories to you, which means I will be talking a little bit.
Right.
I prefer not to, because if I'm talking, I'm not gathering information.
Right.
So I like to let the patient talk to me and give me the understanding I need to help them. My feedback to them is the part where I have to do something, and that feedback is usually in the form of how to see the circumstance differently than they see it.
Right. Do you ever give homework, assign people tasks, or maybe a book to read, or certain things like that?
All the above.
Right.
All the above. It depends again on the circumstance.
Right.
But I've given people books to read, suggested other books to read. I don't usually give them a diagnosis to their face anyway.
Right.
Because you used to be able to do that, but if you do it now, they're going to go onto the internet. Wikipedia is going to come up, and next thing you know, they have all the symptoms of whatever it is that you told them. Right. So you don't want to do that. I give them an idea of what's going on and how it's affecting them and why it's happening.
Right. Well, what about medication and psychotherapy? Because there is this stigma for a lot of people who are in your field. It's just, I'm just going to get a prescription and deal with it that way.
Mm-hmm. Well, as a therapist, I cannot prescribe medications. I'm not a medical doctor. But there are times when medication is necessary if the person's quality of life is so affected that they can't function properly. There's no reason to suffer.
Right.
If you're depressed, believe me, you're suffering. If you're suffering from anxiety or panic attacks, this is a horrible circumstance. And then definitely I will refer you to either a family physician or to a psychiatrist to get meds for specifically what's ailing you, so that you're not distracted with it while we're working on your problem.
Okay. And when we're in the confines of a therapy session, is that kind of like the doctor-patient privilege? Is what happens there confidential? That's not going to get leaked out to somebody. It's totally safe, right?
The only reasons that could possibly jeopardize the attorney-client or the doctor-patient thing, which is exactly the same, following all the HIPAA laws, is if I suspect that you're going to hurt yourself or that you're going to hurt somebody else. If I think that's going to happen, then I may even suggest, or I may even have you put in a place for observations for a couple of weeks.
And you're talking about physically hurting somebody. You're not talking about saying something to hurt somebody's feelings. Just to be clear.
You're right.
You never know.
I'm talking about very, very ill people who are suicidal or homicidal. Those people, I have to say something about it. In 99.9% of the cases, I never have to do anything like that. Okay.
Right.
That does not happen. I've had records subpoenaed. I've been deposed. I don't give it unless I have a release of information form from the patient, and that puts you in contention a lot of times with the courts. But so be it.
Right. And when somebody is seeking treatment from you, that sounds like a medical procedure. So is this the type of thing that's covered with insurance?
It is covered by insurance by most carriers. I personally take most of the insurance companies' programs. It depends on the circumstance, but most of them take it. If you take a carrier, then there are negotiated rates with that carrier, and there are deductibles sometimes, which means that you would have to pay the the payments until you have reached the deductible,
Mhm.
or a co-payment, which mean like it could be like 20, anywhere between $20 and $60, a co-payment along with the insurance.
Right. Right.
So, and
Understood.
the best way to do that is before you engage in a business relationship with a therapist, call your insurance company if you plan on using it.
Right.
Now, we prefer that you don't. I'll just be real and upfront. Although I do contract with insurance companies, once you contract with an insurance company and I diagnose you, that follows you around for a long time.
Right.
Which is why I suggest that people, they pay cash.
Right. And it just, to some degree, it makes sense because you never know what's going to be uncovered with the counseling sessions. And, God forbid there's something that gets uncovered. And once that comes out and it's written in official documents, and if you're dealing with an insurance company, you're going to have to tell them to some degree what your diagnosis is. So that could stay with the person, that could cause problems, ancillary problems down the road. So yeah, it makes more sense if you can afford it to do out of pocket. You definitely do that. And I'm sure that in certain cases, you'll do what you can to help people with that.
Yeah, I'm flexible on those types of things.
Right.
But it definitely is worth not, if you can, to not use your insurance.
Right.
If I want to get paid for the work that we do, then I have to give you diagnosis. That's the way the insurance company have made it. And that will follow you.
Right. So as we're kind of wrapping up here, so we've talked about what the counseling is like, the difference between, therapy and counseling. We've talked about the process of physically how it's going to work. What would you say, Lou, to someone who is on the fence and is unsure about whether or not they need to contact somebody? What would you tell them? What would you encourage them to do?
I would say make an appointment. And what have you got to lose? What have you got to lose? If you make one appointment with somebody to see if you need therapy, okay, that's not going to necessarily require a diagnosis. That's not going to hurt you if you want to use insurance to do that. But again, it depends on the circumstances. But don't take a chance. If you're thinking about it, chances are you probably should do it.
Right. So go ahead.
Now, you may not always need a psychotherapist or a counselor. There are other circumstances that have to do with, your quality of life and the things in your life. And then I would suggest, my friend John here, who is a life coach, he is a leadership guru. The man has got the way to make you put things into perspective and applicable to your real life. That's why we call this the Real Life Podcast.
Well, I certainly appreciate the accolades, my friend. So if somebody was wanting to reach out to you, to contact you, I know you do online sessions. So how can someone find you to get in touch with finding out how they could take the next step?
Okay, there are several ways. One, you can send an email to questions@reallifepodcast.com, and I will get that. Confidentially, you can go to my website and leave me a private message. You can send me a private email, or you can go to my website and you see how I see sort of my take on certain topics like parenting and panic and all those types of things. And you could also email me at another email address, which is lou@lifecarecounseling.net.
That's it. And if you're on the fence, or if you think that you need to talk to somebody, there is no better person on the planet, in my opinion, that you could talk to. Lou has been not only my friend and business partner, but Lou has been my counselor from time to time. And the thing that makes Lou special is he cares about people. He cares about making sure that you're better than how he found you. And no matter what the circumstances, he'll do his dead level best to make sure that you get the assistance, the encouragement, the advice, the diagnosis, if you will, so that you can live your life at that next level. And that's what makes him special. And he does it in such a way that it's not condescending, it's not arrogant, it's not mean. It's just he says the facts, he says it in a caring way, and he helps you. And then it becomes your responsibility to follow his advice. So reach out to my friend, take advantage of his incredible skills, and you will not be sorry.
Thank you, John.
You're welcome.
Okay.
So we've already given you ways to contact us. Thanks a lot for watching. Thanks a lot for listening. We hope that you guys come back and visit us at reallifepodcast.com. Anything else you have to say to close this out, my friend?
No, I was just say earlier in the, yes, here I do have something to say. I said no before. It's not true.
Liar.
In the past, okay, people have looked at other people who go to seek out therapy for mental illness or mental concerns. It was looked down upon. They were chastised from society. That is ancient. Okay, everybody needs help. I always tell my people, if I go outside, I'll find 5 people that need help, even though they may not know it.
That's true.
So anyway, I would suggest
true.
Don't hesitate and don't be intimidated to go, because they're there to help you.
Yeah, the stigma is no longer as bad as it used to be, because I think more people are getting counseling, more people are getting therapy, and it's helping.
It is helping.
Yeah.
There's a good track record there for therapists.
Right. Well, all right, guys, that's it for this week. We look forward to seeing you next week at 3 p.m. for the Real Life Podcast live blab here on blab.im. You guys have a wonderful week, and we'll see you next time.
Bye-bye.
Thank you for listening to the Real Life Podcast. Find out more information and sign up for the Real Life Podcast newsletter at reallifepodcast.com. You can also learn more about our hosts, Lou Carfisi at lifecarecounseling.net and John Donahue at johncdonahue.com. And remember, live your life to the fullest. And as always, we want to encourage you to choose to be awesome, because when you choose to be awesome, you will be. Have a great week, everyone.